I'm Thomas Barrett. I'm Titus's dad.
And I'm Charlotte. Like you said, we have 2 kids. We have Titus. Titus is 5 years old. He has a rare genetic disease, MPS1. And then Eliza is 2 years old, and she is actually a carrier. So she has the gene for MPS, but she doesn't have the actual disease. And it's just the 4 of us and a dog and lots of cats.
I'm Titus. And I'm 5.
We actually met at a Battle of the Bands in her hometown. I was just going there to help my buddy actually set up his sound equipment. And she was there taking pictures, I believe.
Yeah, for the yearbook.
Yeah, just kind of hit it off after that.
We've been together since 2011, so it's been a minute. Got married in 2015. Just kind of took us a little bit. So we wanted to enjoy marriage and travel a little bit and do different things before we had kids. And we had Titus in 2019, first kid. August 2018, I think we first found out. I was probably very early on. And then we didn't have a doctor's appointment until September, I think.
Don't remember.
Because we didn't really tell anybody until we actually went to the doctor, made sure that there was actually a baby. Even though I'm a nurse, I have that paranoia inside me. So I remember we went and did one of those 3D ultrasound things because I just felt like something was wrong. I don't know. I just had the sense that something was wrong. So I wanted to know, am I really pregnant? So we went and had a very early on ultrasound and got to hear the heartbeat probably, I was probably, I don't even know if I was 8 weeks. It was early, very early, but it was right around August that we found out.
I was excited and nervous, I guess, like anybody would be, but mostly excited.
I was terrified. I was absolutely terrified. I remember when I first got a positive pregnancy test, which, like I said, I'm a nurse, so I normally, when I worked full time, I would go into work at 7 in the morning, which I had about a 35-minute commute to work, so I would get up super early. And I knew there was a potential that I could be pregnant, and I got up real early, took a test. I was terrified. I didn't even tell him for like a week. Absolutely terrified. He was 9 days old. He was born early. He was born at 36 weeks. I went for a regular just checkup at 32 weeks and went by myself. Thomas was at work because it wasn't supposed to be an ultrasound appointment, so there wasn't really anything fun for the dad. So I went by myself and got up there. They put the Doppler on my stomach to listen to his heartbeat. And once again, nurse. So I'm like, that doesn't sound right. Because it was just like, dum, 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 dum. It's like, that's way too fast. So I texted him and I was like, you probably need to go home and get my bag. And he's like, what's wrong? Like, I'll call you in a second. So they immediately took me in for ultrasound. His heart rate was,
It's like 200 something.
230 something. And that's obviously not normal. So they were like, you need to go to a bigger hospital. Don't feel comfortable with you staying here. Do you feel okay driving there? Because it's going to take you, they can't do anything for you in an ambulance. Do you feel okay driving there? I'm like, yeah, give me my papers. I'll go. So I called him. I was like, you need to leave and meet me in Lexington, which is 2.5 hours from here. I got in the car and drove myself to Lexington. I didn't know if I was going to have a baby that day. I didn't know if he was going to be there. I had no idea. Drove myself to Lexington. They ended up getting his heart rate back to normal with medication. And so 4 weeks later, at 36 weeks, they said his heart's not pumping quite as well as we want it to. Let's go ahead and have a baby. Pediatrician, I think, she pulled us into her room.
Yes, I like that.
And she was like, so there's this test that we do. It's newborn screening. It tests for a lot of different diseases that are it's better if you catch them early because there's more they can do about them. And they were like, she said, he has actually had something come back as positive. And she said, it's MPS1. She's like, it's really rare. She said, I don't think he has it. She said, he doesn't show any signs of it. So it's probably a false positive. But we're going to send you to a genetics doctor just to follow up on it. So we were like, okay. She said, don't Google it. So I didn't Google it.
I did.
He did. Yeah. And he was very upset because when you Google something like that, the information, I mean, granted, now we know it's from like the 1990s. So now we know, but at that time we didn't. So he was really upset. I was still pretty calm at that point until I saw that he was upset. And then you add in freshly circumcised baby, crying, upset. We literally left the NICU, should have been going home, and we were going to another hospital to go to a doctor's appointment. Postpartum hormones. She was asking us all these questions that I didn't even know the answer to. So I just cried the whole appointment because what else are you supposed to do? So I just sat there and he had to answer most of them because I literally just cried the whole appointment. They were like, we're going to go ahead and start setting this stuff up. And in my head, I'm thinking the pediatrician just said he probably doesn't have it. Why are we doing this? But I just went with the flow and just let him do it. And so he was 9 days old. And that's when we first found out that he would likely have it. And then we went back when he was, how old would he have been? April 16th, 4 or 5 weeks old.
Something like that.
And went to Cincinnati, which I knew before then because I had did my research and I knew based on his lab work and stuff. I asked the right person the right questions and I already knew, but we got confirmation when he was around 3. He was 3 weeks old.
You're good.
Big shock. Very emotional day. I think I literally sobbed the whole way home. And I think we actually stopped at my parents' house. And I think I told them at that point, because I mean, my mom knew. She knew something was wrong. Because I mean, I came back and I was just bawling. Like I bawled the whole way home. He had to drive. I just sat in the back and cried the whole way home. Couldn't stop. We're very thankful for newborn screening in Kentucky. And that it includes MPS1 because, I mean, at the time Titus was born, Indiana, which is a neighboring state, didn't even have MPS1. So, I mean, if we would have just...
It's odd because Kentucky's typically kind of behind on all that stuff, so it's kind of shocking.
Yeah, Kentucky's usually last on the totem pole, but they were on at this time. And so we were able to get the earliest diagnosis possible because we had no history of this in our family. I mean, from what we know, everybody... as far as we know, has been pretty healthy in our family. No genetic issues in either side.
I mean, it was upsetting, obviously. You're kind of just going through the stages of, why me, why our kid, all that stuff. But at that point, you're just kind of, well, we got to listen to the doctors and do what's best. So.
I was a mess.
She didn't take it too good first of all.
I was an absolute mess. I mean, even being a nurse, like I know that all these things can happen, but you never think it's going to happen to you. Like you never think, you see even just kids with cancer and different things, you're like, you feel so bad for that family, but you never picture that you might be in those shoes. So we just always assumed that we would be bringing home a healthy baby, even after, a NICU stay and everything. We just thought he would be healthy. And so I can literally show you exactly what room we were in at Cincinnati when they gave us the official diagnosis. It was just one of those moments that it just unfortunately sticks with you. And I remember thinking, gosh, I would just love to just pack him up and just hold him and just run. Like, I don't know where I was going to run to, but then I thought, that's not going to do anybody any good. That's not going to help him. Like, I need to get him the treatment he needs. But all I wanted to do in that moment was just hold my little tiny baby and just run away from everybody and just sit with him. And I remember, like, the first, couple weeks or so after being home, like, I would get up at night to nurse him and I would sit in the rocking chair with him and I couldn't look at him without crying because... you started doing all the research and you just, in my head, I thought he was going to die. So I would literally just hold him and just cry. And it took me longer to get out of that hump than it did for him. But I'm Titus's personal secretary, so I organize all his doctor's appointments. Not a paid position, by the way. Just paid with gratitude and hugs sometimes. But he underwent a bone marrow transplant at 3 months old because they pretty much just sent us straight there, said this is the best form of treatment that we know of for this disease right now. He received IV therapy for the enzyme that his body was missing. They make a man-made version of it. It's given through an IV infusion weekly. So getting that started was a nightmare because we live in a very rural area.
Remember, we tried to get it set up in Lexington first. And that wasn't
Yeah,
working.
Lexington, we thought, gosh, UK hospital, like, if anybody can do it, they can. No. So, and then it was like going through the insurance hoops and stuff, and I finally just said, this is taking long enough. Set it up at Cincinnati. I would drive there every week. I just want to get this started for my child. So we went to Cincinnati every week from the time he was 5 weeks old until...
That's 6 weeks, wasn't it? 6 weeks we did that.
Yeah, something like that. I mean, but they were really good about trying to, like, coordinate other appointments and stuff, like different doctors that he needed to see. They tried to coordinate stuff like that while we were already there for, like, because the infusion was, we were there for 3 or 4 hours every week.
It was slow.
But it was... Then he had his bone marrow transplant. He received, his donor wasn't another person. It was actually, you can either have a bone marrow donor or you can have cord blood. His donor was actually an international cord blood. We don't know what country it came from. We like to joke and say it came from like Italy or something because he likes pasta and things, but we don't really know where it came from. So he received his about a little over a week of really intense chemotherapy. And then he got his bone marrow transplant on June 28th, 2019, 2 days after he turned 3 months old. Cincinnati has been great to us. I know it's always a toss-up between where people want to go for transplant. Do you want to go to Cincinnati or Minnesota's the top? But they do things similar but kind of different at the same time. But Cincinnati's been great. They were great for transplant. They've set us up with all the specialties we need to see. I mean, his transplant doctor, I can message her right now and be like, I think we need to see this specialty. And Dr. Candlewall would be like, done. Like, she's just amazing.
What kind of doctors do you go see? Like when we go to Cincinnati?
I don't know what their names.
You don't know your doctor's names?
No.
What do they look at when you go?
At the eye doctor.
You do go to the eye doctor. What other kind of doctors do you see?
The poke one.
Yeah, sometimes we have to get pokes at the doctor.
And the heart doctor, and the back doctor, and the dollhouse too.
At the Ronald McDonald House?
Yes.
You love going to Ronald McDonald House, don't you?
Yes.
But not the doctor part.
No. I love Dr. Brown, though.
You love Dr. Brown?
Yes.
That's our pediatrician.
We usually do a week long of annual appointments. We usually have 13 to 15 appointments in 1 week. We usually go up on Sunday, stay till Friday, just knock them all out 1 week. He was still deployed, so I went by myself, and we kind of got a curveball thrown at us. And we went for the hip doctor appointment, and they were like, Titus is probably going to need hip surgery next year. And I'm pretty sure he probably could have just poked me and I would have fell over because I did not expect that. So started doing my research and talked to several other families that have been through the surgery, and Delaware, Nemours Children's Hospital in Delaware came up. There's a surgeon there that has, his father was actually a surgeon, did surgery on like tons of MPS patients, and now he's retired and his son's taken over his practice. And his plan of care for Titus really seemed a lot better than what Cincinnati was presenting to us. So we're going to go there for hip surgery. We haven't set a date yet, but probably June maybe is kind of what we're thinking. So he'll be 6 years old. He'll have surgery on both his hips. He'll be in a wheelchair for 6 weeks, unable to walk. And then we will go back to Delaware after 6 weeks, have x-rays, make sure everything looks good, and they will actually keep him in the hospital there and do inpatient therapy for 3 hours a day. So that was kind of the deciding factor for us, because otherwise, like at Cincinnati, we would be discharged home and we would have to get therapy here. And there's just not anyone in a rural area that would have that kind of experience with a child. So Delaware just kind of seemed like the better option for us. But he also needs carpal tunnel surgery. So we're working on scheduling carpal tunnel surgery before we schedule hip surgery, because he's going to have his hands for hip rehab, because he's going to be using a walker and having to relearn how to walk. So we've kind of been in the honeymoon phase since between transplant, because this is kind of the first big thing that we've had to deal with. So it's kind of a shock. And how do you prepare a 6-year-old? Like, you're not going to be able to walk. I mean, even though it's temporary, like, you can't prepare a kid for that. There's no way. Because, I mean, he runs and plays like any other kid.
Play, with Jace and everybody.
Play with Jace and everybody?
Yes.
What do you like to play with?
Nerf gun.
Nerf guns.
Roombas.
You like to play Roombas?
Tam.
Yeah.
It's just automatic with Cincinnati. I mean,
Yeah, they kind of do it all for you.
yeah, they
actually.
just kind of set us up, and we didn't ask any questions because we didn't know any better. So we knew nothing about MPS. We didn't know any families at that point, and they said, here, we're setting you up some appointments at Cincinnati Children's, and we just rolled with it because we didn't have the emotional bandwidth to even research anything at that point. I do remember our pediatrician, he was a former coworker of mine, so I knew him, and he was like, it's one of those things in med school, they say, this is MPS, you'll never see it in your medical career. He was doing research, so he could know how to take care of Titus as his pediatrician. And I remember he had to be somewhere, and my younger nephew, he's probably around 14 years old, he rode with me to take Titus to the pediatrician to just be an extra set of hands for me that day. And we were sitting there, and I was talking to Dr. Brown and was telling him all these things I'd read about MPS. He just looked at me and he's like, Charlotte, are you sleeping? It's like, nope. Sitting up all night long reading research articles because I don't know what else to do. But that's what you do. I mean, you try to, when you're just blindsided by something like that, you try to just, all you can do is educate yourself the best you can. And there's no right or wrong decision for your kid at that point. You just do what you feel like is best, and that's all you can do, because there's no book that tells you this is the steps you need to take when you have a child with MPS. We're all learning as we go. Hold on. Push. Transplant was both a milestone and setback all in one. Milestone because it worked. It has helped him. Kind of the goal of bone marrow transplant is just to decrease the burden on your body by giving you some of someone else's enzyme to help break down those waste products that cause all these issues with MPS. So he still is above 95% donor cells. So that means that 95% of his body is the donor cells. So that means that he still has enzyme within his body that's helping break down the trash material, just to put it in layman's terms. And so just making it through transplant and still doing well post-transplant is a milestone, and really surviving transplant.
Fortunately, yeah.
I mean, he was so sick. He ended up with bacteria in his blood, and he was on the ventilator in the ICU for 2 weeks, which was kind of a blessing and a curse. Obviously nobody wants their child to be on the ventilator, but that was during the point where he was going to be the sickest and having the most pain. They had him on a morphine drip. He was miserable. I mean, he would just cry because the chemo causes sores all the way down your GI tract. So he had an NG tube. We would put his breast milk down the NG tube. I was still trying to pump to give him what breast milk I could, which obviously with all the stress, it wasn't much, but what I could do, I just tried to do. And he was miserable. And then he got really sick one night. There was a gym nearby, and so sometimes I would go to a fitness class just to get out of the room and do something, and he would go to the gym. And he had went to the gym that day, and it was around that time we were just holding him 24/7 because he was just miserable. He would stay up all night with him, and I would sleep during the night, and then in the morning we would switch out, and he would put like a mask on and earplugs in and sleep during the day so I could be awake when the doctors rounded, and we just switched out so somebody was awake with Titus 24/7. I was sitting there with him, and I just knew something wasn't right, and he was having these episodes where he would just stop breathing, but they were short and he would recover. So I was watching that monitor, watching my child like a hawk, and then the episodes started getting longer and longer, and then one time it went too long. I watched his oxygen level drop down in the 60s. I slapped the emergency light on the side of the wall. I'm pretty sure I had oxygen on him, and I had suctioned his mouth out in the time that it took them just to gown up and jump in the room. And then once everybody got in there and they took over the situation and everything calmed down, I just broke down into tears because it was just like the adrenaline just wore off. And I called him and I was like, you need to get here now, because I didn't know what was going to happen. So they transferred us to the ICU. And at that point, I was kind of worried that something neurologic was going on with him because you remember his cry? It was awful. He just didn't sound like Titus. And I thought, God, please just bring us through this, because I just don't know what to do right now. And they put him on the ventilator the next morning. He was on the ventilator for 2 weeks, which was traumatizing, but also was very thankful they let us stay in the room for everything. They never kicked us out of the room. We were able to be right there with him. But when they brought the chaplain in that morning, that was the point where I was scared. But I tried not to show that I was afraid, because I knew if I was afraid, he would be afraid. So I remember going to the bathroom and just like bawling my eyes out because I didn't want him to see me upset. I don't even know if you know that or not. Yeah. Transplant was hard. And I mean, we watched families go through the unimaginable. So like the fact that our kid came through transplant is a huge, even though it was a setback, all the things he went through, it's a huge milestone that we brought our baby home, because there's so many families that don't. And I couldn't imagine being in their shoes. I mean, it breaks my heart every time I see something about like an MPS family losing a kid, because I'm like, that could have easily been us. But it was a milestone and a setback all at once, if that even makes sense.
Nowadays, it's probably just appointments. I'd say they just schedule that stuff, which she does most scheduling once again. I'm just kind of here.
I left my full-time job after, I was going to try to do PRN, but I don't know what I was thinking. Like, you can't work while you're in bone marrow transplant. I guess I thought I was superhuman or something. But I left my full-time job, and he really wanted me to be the one that stayed home with Titus, which after transplant, then, we had the lovely COVID-19 pandemic. So we had that. So I couldn't risk going to work in an ER setting and bringing home germs to my kid. So I just work PRN now, which works out really well. I don't have to use vacation time to go to doctor's appointments, because it's not a vacation. Don't have to do that. So now it's mainly just working. He's really fortunate. He works for his family, so he can take off work and be with us for appointments. And then he's also in the military, but with the National Guard, he just has to go a weekend a month. Usually. But yeah, usually, except for the fact that he just got home from a 10-month deployment. But it's just all getting all the appointments coordinated. Sometimes it works out really well and you can get them all in 1 week. And then there's other times where we're going like 3 times a month. Yeah. So that's the biggest challenge for us right now, is just the appointments. He's came really far in therapy, and we kind of took a break from speech. I mean, 2 years ago, the kid could barely speak an entire sentence, and now he is...
Let's stop talking.
It's 24/7. So we have took a very deserved break from therapy for the moment. So now it's just doctor's appointments and follow-ups.
I mean, now it's just medicine in the morning and medicine at night, and appointments like we already talked about, but...
The Darwin medicine.
Darwin medicine.
And
How about these?
eye drops,
Mm-hmm.
and the comments. Nose spray.
Nose spray?
I take it in the night.
You do take it in the night.
And my breathing medicine.
And your breathing medicine? You take one more medicine. Do you remember it?
Yes.
What is it?
It's the broccoli.
Broccoli. Cough medicine.
Which
What about your sleepy medicine?
sleepy medicine?
Your melatonin?
My melatonin. Mom, which one I have to take one more?
No, you're all done with your cough medicine. Maybe.
Well, maybe. I guess, I mean, for me, I'm a little more careful, I guess, what he does. Like when we're out in public, just like McDonald's playground or something like that. Like, I don't really like him to join in with the other insane kids, if that makes sense. But that's probably about the only difference for me. It's like
We
CCL,
hover more.
yeah.
We're.
Yeah,
I don't think we would have been helicopter parents.
Probably not. Because with Liza, I just,
Yeah.
fault slide if you want to,
You'll be okay.
Yeah.
But yeah, it's different with Titus. I swore I was never gonna be a stay-at-home mom.
Yeah.
Famous last words. Like, how many times did I say that while I was pregnant?
A lot, yeah.
A lot.
She's definitely Miss Independent, so you can't tell already.
Yeah, so that was a big change for me, staying home, which I wouldn't trade my time with them for anything. I do get a little stir crazy at times.
I mean, I guess rewarding to be like whenever, he was delayed on a lot of just, speech and functions and just daily things when he was a kid. So it was more rewarding, I feel like, whenever he was actually able to accomplish them.
I feel like we celebrate like the small victories and like big ones. Like we make a big deal out of small stuff and people don't really see the importance of that because it's so natural and normal for their kids. But I feel like we just really make a big deal out of stuff like that. And I mean, definitely still the biggest challenge was transplant. That was horrible, but it's part of it.
For me, they put me through a lot of stuff that I didn't think I'd ever have to deal with. So I feel like, I guess you grow as a person when you have to deal with this kind of issues. But so there's negative and positives, I guess, to it.
Yeah, he's always kind of distanced himself when
Things get
hard things happen like
like
that.
health
Wise. I've noticed that, well, even before we were married, but I mean, there was no distancing yourself when it's your child. I'm definitely a more anxious person now than I was.
Yeah.
I mean, not even just about Titus, but just about everything. But I mean, there's definitely a lot of medical trauma there. I mean, watching your kid be on the ventilator, watching your kid get intubated, just all the unknowns, it really does something to you. It's those things that you just can't unsee, and it's really hard to work yourself through those, and I mean, just all the trauma that came with not just Titus, but all the things that happened during bone marrow transplant and during COVID when we were isolated and everything, it really affected me, in a not so positive way. But I also think that now things that used to would bother me, they don't anymore. It's just
Not that important.
I feel really guilty because like sometimes I'll listen to other people's conversations and I know he gets so mad at me for this. Somebody will be talking about something and it'll be a big deal to them.
It's so trivial, really.
And I'm just like, they're really worried about this. Like they're freaking out over this with their kid. Like why? And it's really hard for me to empathize with those smaller things now. And I hate that. But it's just because we've been through so many other bigger things that those little things are nothing.
I've got a bad track record.
Do you cope with stress?
I don't know if I cope with stress. I just kind of I don't know. I'm good at, I don't know. I don't know if it's like a defense mechanism, but I don't really think about stuff a lot unless it's presented itself right in front of me and I have to deal with it then and there. So I guess maybe she has a better answer to that question.
I don't cope with stuff well at all.
I guess we just live with it.
Yeah, I mean,
I try not to think about stuff.
I have to have like a plan. Like like this surgery coming up, like obviously I'm anxious about it, but once there's like a plan in place, I feel better about things. So I'm like continuously trying to just like make sure everything's in order and have a plan. When I get stressed, I'll just come through with bags and start bagging stuff up to take to Goodwill, and it just makes me feel better just because that's something. I guess I cope with stress by like channeling in on something I can control, if that makes sense. Like, I know I can control the clutter in my house. I can't control what surgeries Titus has coming up, but I can control the clutter in my house. So I will take bags and just bag up all the clutter or clean, like something that I can like physically see that I have done something and made something better. I guess it makes me feel better stress wise. I plan a lot of trips too. That may be my stress.
Maybe that's what it is. I don't know.
Maybe that's why I plan so
That's
many
where all my
trips.
stress comes from, is your trips. So
I just like result and go. And I mean, granted, 98% of the time when we do these trips, like we're the ones stressed out and the kids are having a blast.
having a great
But
time.
it's totally worth it.
friends and family do it, they can. But I mean, they don't really know what you're going through. I don't think you can really talk with them and them understand what you're going through. And I don't have a support group with other MPS people because I just don't want to do that. But she does, and she says it helps a lot. So.
Yeah, I actually have like several moms that I message on a daily basis. Like it's like continuous all day. Like sometimes you'll wake up and you'll have like 50 messages, and it's a little overwhelming. But it's really nice to just have like those people that you can go to, and like we've got hip surgery coming up. So like I can message different moms and be like, hey, you guys just went through this. Like, do you have any pointers? What would you recommend? So it's really nice to have like that option for people that have went through that. Which I get, like, we're two different personalities. So like that's more beneficial for me, but then I also relay that information to him and he benefits from it also.
Yeah.
It's really weird. I always say that like when several of the MPS families get together, it's like a big family. And my sister went with us when we went on the Dollywood trip, and I told her, I'm like, you're gonna love these people. Like, you're literally gonna love these people. And she's like, yeah, we'll see. And we get there and we leave, and she's like, I feel like I've known these people my whole life. And she's like, that was awesome. Because like when we're all together, it's like, you know, we just jump in and help each other because we know that's what we all need. So we get that. So it's like, here, I'll grab your kid, or put your kid in my wagon, I'll push them, or let me grab that wheelchair for you. And I mean, there's people carrying different people's kids, people pushing kids around, like, or like, you know, a kid wants a snack, we just go get it for him because it's just like, I don't know how to explain it. It's just like this bond that we all have, even though we don't see each other very often. When we all get together, it's like a family. And it's very natural. Like the relationships that I have with those families are all very natural. They're not like force-filling relationships. So, I mean, I really value that just in the MPS community in general. You just know that they get it. And they've been through what you've been through in some way, shape, form, or fashion. And you don't have to explain your thoughts or feelings to them. And you don't feel like if you want to complain about something or cry about something, like they're not going to judge you for that. And it's just a different kind of friendship. But I value my friends here at home too. And they've been a huge support to me and help. But it's still just different when you get around other MPS families. Unfortunately, I've only got to attend one advocacy event, and it was virtual. It was during COVID, and we met with local senators and stuff through Zoom, and it was really beneficial. One of the local congressmen from our area signed on to a bill that I was asking him to support. I would really love to get to do that in person, but unfortunately it is just our schedule and everything is just not happened yet. But I hope to do more of that. Maybe this year for Rare Disease Day, I can actually go to DC and do that in person, because I think that would be really awesome. How many shirts do we sell?
Oh, I don't remember. It was 1,000 something.
It was insane. Like, we still run into people wearing Titus Tough shirts, and we have no idea who they are. Because the kid is literally a small town celebrity. Like, everybody knows Titus. I mean, I can't tell you the amount of times I've been somewhere because like obviously transplant, COVID, we didn't get out much for a while. So like I'll be out eating somewhere with him, and they're like, "Oh, that's Titus," and I'm like,
How are you?
yeah, I'm like, I have no idea who they are. But we t-shirts has kind of been our biggest awareness efforts, I guess. Just
Sure.
And I mean, we're really active on social media, on Titus's little Facebook page. I mean, we've tried to be very transparent in our transplant journey, because I know that when he first got diagnosed, that's what helped me the most, was talking to different families that had been through an early diagnosis in transplant and could give me the good, the bad, and the ugly, like everything. I wanted to know it all. And I know, oddly enough, I mean, on several occasions, I've had some random person like message me on Facebook, and they'll be like, my kid we just found out that they have a positive newborn screening for MPS. I searched for it. I found your Facebook page. Can you talk to me? I'm like, absolutely. Because I remember being in those shoes very clearly. It's just a feeling you never forget. Well, actually, I think it was my sister started searching. Allie and Ryan were the first people that we found, Kennedy and Lincoln. And we were, looking through what they had been through. And I remember I messaged Allie. But like at the time, I wanted to talk to somebody, but I was also not ready to talk to somebody at the same time. But Facebook has its faults, but that is definitely a strength, because there have been, and I know there's sometimes, like I'll have a mom message me, and it'll be an older child that doesn't, newborn screening for MPS is just not a thing where they were born. And they're like telling me their story of how they went to the doctor and they're thinking MPS. And then I see a picture of the kid and my heart just sinks, because I know. We're in Fort Walton in Florida, and this lady, I think she came over and talked to me. She recognized Titus from Facebook. And we're like, I mean, we're 9 hours from home, and we're like, that's crazy. But I mean, that's, in situations like that, that's one more person that knows about MPS. And I mean, who knows? Like, that person may have a grandson in medical school or something. They may really take an interest in it, and then that could be the person that finds the cure we need. You never know. I mean, I believe something like that could easily happen. It's just whether or not it happens when we need it to happen, that's up to God. That's not up to us. But that's like our biggest prayer, is that there will be a cure sometime in Titus's lifetime, like where it will still be beneficial to him. But yeah, it's always a really small world when you run into somebody like that and they recognize your kid from 9 hours away.
Yeah, that's ironic.
It's so funny, the people that we've met that, like, until you actually start having a conversation with them, they think he's a normal kid. They have no idea anything's wrong with him. And I just think that alone goes to show you that, like, you never know what somebody's going through. Like, you see things on the outside, and it's not always the full picture. So I think it's just really important just to be kind to everybody you meet. I mean, you never know what anybody's going through or what they're dealing with behind closed doors. He seems like such a typical kid, and a lot of people wouldn't realize that he, has 25 doctor's appointments a year, or that he was so far behind in speech, and like that he's worked so hard to be where he's at. I just think it's really important just to be kind to everybody.
I just want him to live as normal a life as he can, as he wants to, let him be able to just do everything he wants to do without, restriction.
Be as independent as possible. I mean, we try to just take it one day at a time.
Don't try to look too far into the future.
No.
It might be good, it may not be,
Yeah. We, so everything's still so unknown with MPS. I mean, there's no, like I said, there's no book that tells you exactly how all this is going to play out. So we just kind of take it one day at a time and try to get him all the resources that we can get him to help him be the best person that he can be, which we think he's pretty awesome. He just absolutely loves to make people laugh. If he does something that makes you laugh, you just might as well get ready to hear it
Yeah, a lot.
100 more times. I mean, we just want, everybody always wants the best for their kids. So ours just might need a little more help than others. And that's okay.
It gets better. It's overwhelming at first, for sure. All the information, all the unknowns. It gets better. And there's people that can help, like her. Not me, but there's people that can help for sure. Make it an easier process.
I'll probably cry talking about this. Like, I saw something on Facebook, oddly enough, and it really just like tugged at my heart. And it said, my hands are full, but at least they're not empty. And like, I thought, oh my gosh, like how true is that? Because people are always telling me like, oh, you've got your hands full. And I'm like, yeah, I do. But it's not the life we would have chosen, but we have Titus. So we're very thankful for the life that we have, even though he has MPS. But like, there's so many families that don't get to take their child home. So yes, our hands are full, but thank God they're not empty. You're not going to make a wrong decision for your child. The fact that you're trying and the fact that you are going wherever you have to go to get treatment, to get bone marrow transplant, to do a clinical trial, whatever treatment route that you choose, it's the best option for you and your family, and you're making the best choice for your child based on the information you've been given, and that's all you can do. So I hope that no parent ever goes to sleep at night and just worries that they did the wrong thing. Even the parents who don't have kids with them now, like, they did the best thing that they could do for their child. It wasn't up to them what happened in the end result. I always tell parents, like, just go with that and go with your heart and your gut and use your brain in the process too. And, just be grateful for every day that you have with your kid. Make the most out of everything. I go a little above and a little extra on birthdays and holidays and stuff, but it's not the stuff that counts, it's the memories. And that's why we take all these ridiculous trips and stuff, because like, that's what they're going to grow up and remember. And that's all you can do is just make the best out of every day and just because we don't know. Nobody, even anybody with a normal kid, we don't know how long that God's going to give us this kid, because these kids are borrowed. They're not, nobody's here to keep. And so we just have to make the best out of every day and just, make as many memories as we can for everybody's sake. And that's the best advice I can give a newly diagnosed family. The best thing that they told us was, if you choose not to treat him, he'll live to be,
It's like 8 to 10 or something like that, where I'm treated.
8 to 10 years old. Kids now, like, enzyme replacement therapy has only been around since 2005.
Yeah, something along.
And then doing, newborn screenings came a long way. Kids are getting diagnosed earlier. Enzyme replacement therapy is starting a lot earlier. They're transplanting kids at 3 months old.
There's no hard data. Like, they're still aging for the new treatment plans and all that.
Right. So we don't know. The only thing that we do know is that, the most common cause of death in Hurler patients is sudden cardiac arrest. Surgeries are risky. Anesthesia is risky. It's all risky. But and it sucks having to sign those papers saying that it's okay to do this to your kid, because you don't know what the result's going to be. But you just hope and pray for another day. I saw something else that was kind of funny. Somebody shared it one time. It said, I'm talking about terminal illnesses, and it said, like, I barely watch the expiration date on my food, so no, I'm not gonna worry about one with my kid. So I try not to think about that aspect too much. Just try to make the best of every day.